Hello, Eddie. Good afternoon. Good morning. Yeah, please. Representative Gray, come on over here. Yeah. I don't see Senator Bledsoe. Thank you for joining me today. I'm joined by some folks that are very dedicated to improving health care in Arkansas. Secretary Mark White has joined me here at the podium. I want to welcome Senator Missy Irvin, who is the Senate sponsor of the legislation that allowed us to have this victory today. Representative Ladyman is chair of the House Public Health Committee, and then Representative Gray is a sponsor on the House side as well of this. So thank each of you for your leadership on improving health care in Arkansas. And let me first give some background, and then I'm going to make an announcement that we're going to talk about a little bit more. First of all, if you look at the history of Medicaid expansion in Arkansas, in 2013 was the first iteration, which was the private option. And then in 2016, after I got elected, we continued the expansion of Medicaid to the new population. We called it Arkansas Works. And then in 2022, with the legislature's guidance, we wanted to improve health outcomes and require more from our insurance carriers to improve health outcomes. And so we developed ARHOMEs. And again, I want to applaud the General Assembly for working so diligently to improve these outcomes. All of these parts of Medicaid expansion are designed to serve about 300,000 Arkansans with improved access to medical insurance and improved health care. ARHOME, which is what the legislature has approved, which is the new Medicaid expansion part of our health care in Arkansas, focuses, as I said, on health outcomes by holding the insurance carriers accountable for meeting health improvement targets. And with ARHOME, the state also has asked the Biden administration, CMS, Center for Medicaid Services, to approve an amendment to our Medicaid expansion plan to provide increased medical care and services through our rural hospitals. This is called Life 360. So you have ARHOME as the Medicaid expansion. Life 360 is the portion of it that is focused on our rural hospitals and improving care to certain at-risk populations. The amendment focuses on improved maternal care. It focuses on improved mental health services in our rural areas. It focuses on addiction services and challenges that we have in our state. And it provides more support for those coming out of foster care and those coming out of prison. These are very vulnerable populations, and if we can improve their health outcomes and their access to addiction treatment, or whether it's mental health services, or whether it's some other health need, then we're going to not only improve their life outcome, but we're going to reduce the cost of health care that's associated with the at-risk population. And so with that background, today I am announcing that our amendment for Life 360 homes has been approved by CMS and the Biden administration. This is something that we've worked very hard on. Secretary White and his team has worked diligently to get this through CMS, to get this approval for this amendment, because we know that it'll make a great difference for very vulnerable populations in Arkansas. And the reason it is so important is that Arkansas maternal mortality rate is one of the highest in the nation. Our infant mortality rate is one of the highest in the nation. And so we've got to tackle these difficult problems that we've had for decades and decades and decades. Our focus is supporting women with high-risk pregnancies, and it will expand services to them, not just through birth, but up to 24 months after birth, after the baby is born. In 2021, there were 12,500 women in Arkansas with high-risk pregnancies. This will increase services to those women with high-risk pregnancies. Our focus will also be those that have been involved with the juvenile justice system and young adult veterans who are at risk of homelessness or addiction or in need of mental services. The age population for those would be ages 19 to 24 for those young adults coming out of the juvenile justice system or out of foster care. For the veterans, it would be ages 19 to 30 as the vulnerable population. But we will be asking for increased mental health services in our rural areas. And these services will be provided by our rural hospitals across Arkansas. Some urban hospitals will be eligible for some of the investment, but primarily this is a rural hospital initiative to help our rural hospitals to survive, but also to provide increased services in the areas that I have described. The hospitals will be paid monthly for the services, whether it's mental health services, maternal health services, or some other identified need for an at-risk population. I know the question is, well, how much does this cost? And this is an 80-20 split with the federal government, where they pay 80% of the cost of this initiative, and the state pays 20%. We'll be putting in $3.2 million in general revenue with $13.6 million in federal money for a total of $16 million in the investment. And again, I expect that this is going to reduce healthcare costs. A good example is if you have a high-risk pregnancy and you limit services to at birth, they wind up in the NICU unit where they have to have specialized care. And if we can improve those health outcomes, reduce those costs for those at-risk pregnancies, then that helps us budget-wise as well. But this is a very important initiative for Arkansas. If we can improve maternal health care, reduce infant mortality, if we can improve the services to our veterans that are coming home, in our rural areas particularly, and if we can help those that are coming out of prison or foster care have better health outcomes that improve their chances of success, then this is a great story for Arkansas. With that, let me invite Secretary White for comments.
Thank you, Governor. This is a very exciting day for DHS, and we believe for the state and for our state's healthcare system as well. When the discussions first started around this concept, when we were talking with the governor about his vision for the future of Medicaid expansion, talking with legislators, talking with doctors and other health professionals, there are several themes that we heard again and again. One of those was about the importance of accountability and for the need to ensure that health coverage was resulting in good health outcomes. One was about maternal and infant health, and as the governor noted, our too high rate for maternal and infant mortality. Another one was about the growing number of rural Arkansans in need of behavioral health services and those in mental health crisis who needed options to respond to those situations. And through that, those themes is what came together as this proposal for Life 360. We're very excited about it, glad that the federal government is allowing us to move forward with this. We think this is going to generate some great outcomes for our state, both in terms of health outcomes for Arkansans, but as well as financial outcomes for our management and for the long-term sustainability of our state's Medicaid system. So I just want to say thank you to, of course, number one, to the governor for his leadership on this issue. I want to thank you to Senator Ervin and Representative Gray, who not only did they sponsor this bill, but they were deeply involved in pulling the concepts and the details together behind this bill, and we appreciate their expertise and their help. For Representative Lademan and Senator Bledsoe for their leadership of the public health committees, and certainly want to thank my predecessor, Cindy Gillespie. This is her leadership on this helped bring us here. We would not have gotten here without that work on her behalf. And thank you also to our DHS staff and stakeholders for their help. Thank you, Governor.
Thank you, Mark, and with that, we'll take any questions.
So when did the federal government approve this?
Mark?
CMS will be issuing that approval, should have been about 5 minutes ago.
I thought it was today.
With respect to the success homes, I was just wondering how you all settled on those criteria, the formerly incarcerated youths and the veterans.
Well, these are vulnerable populations, and we want to give them a chance of success. And so whether it is the foster care that we've grown to realize that if we want them to be successful, we can't cut off every service when they turn 18, whether it's educational help or whether it is healthcare assistance. Whenever you're looking at those that are coming out of incarceration, they want to have a second chance in life. We've helped in terms of reentry programs, but healthcare is a big part of it. And so if we can identify if they have a drug issue, let's get the addiction services to provide for them. But many times it's mental health. And so by having access in our rural areas to increase mental health services, then that will help them. Why did we identify that population? Because it's an expensive population whenever they can't make their way, they can't get their second chance, and they resort to something that crosses the line with the law and they go back to prison. So it's a good investment for us. And I want to invite the legislatures if they wanted to add to that, because this, you all were very engaged in identifying the populations that we needed to address.
Thank you. Thank you for the question. I think collectively we looked at where we are as a state and where we really needed to do some work with the different populations that are served under the Medicaid expansion population. And when you dig down into who the clients were, what their usage of the Medicaid expansion program is, and what their needs are, I think that also helped shape the policy and the different populations that we decided to work with, especially in the maternal health home. Just like the governor said, it's so important that we work really hard in preventive care in order to prevent a baby from being a preterm baby, for requiring a stay in the NICU, which is very expensive. But we want to make sure that we give that mother and that baby the best chance at a healthy and successful life as possible. And so it's really trying to reshape and focus the policy to where we bring all the services, much of which are already available to them, but bring it in a more intentional, focused way to really achieve a better outcome for that person and that individual, and for that baby particularly. So I think it's the idea and the concept is to kind of use this program as the hub of the wheel and really bring all the services to that person where they are and meet their needs to try to help them get a better and more successful, healthy lifestyle and more success for themselves personally. And so that's really why we decided to go this route with the Life 360 homes.
We got a new governor coming in and new legislators. So this does no good if we go through our annual, fight over the private option for the past 10 years. So how do y'all feel, the legislators, about whether, are we going to go through that again, or is the program safe? Are we done, and are we going to have this?
I'm going to ask Representative Lademan to address that, but this is, even though there's going to be a change in administration, this has legislative support. And so since it's a legislative initiation and has that broad breadth of support, I would hope that this would continue without any controversy. But Representative Lademan?
Well, first, I want to thank the people up here for the hard work, Missy and Representative Gray. They worked really hard on this, and Governor, for your support. I think it's a game changer for Arkansas, I really do. As the governor said, we're one of the worst on infant mortality and some of these other areas that we talked about, the 3 areas of focus. Well, to improve our health outcomes, or our health in general, we need to focus on the problem, and we need to focus on the worst problem. That's why these groups were chosen for us to work on, because that's where the major issue is and the major cost. In order to improve, if we want to move from 47th, I'm not sure Mark would know where we are, but to 46th, we have to fix the worst problem. And we feel like these are the worst problems. As far as the legislature in the upcoming session, I think we have full support. If you look at the votes on this issue, we had full support for this program. And I think we'll have that going forward in the next session. But if we focus on our most difficult areas, then we can improve. And we may have to take small steps at first, but this is a big deal, and I believe it'll help us tremendously going forward.
Governor, I'll go to the softball to you here, but this has been one of your pet projects, and it, arguably wouldn't have survived without your work in the first session. How do you feel about the Medicaid expansion now that you're going out to pasture?
It's been an Arkansas success story in the sense that we quickly moved up in terms of improving access to health care in our state, which is one of the greatest needs. And you look at other states that resisted it, many of those now have, through initiated acts, adopted it. In other words, it has broad public support because of what we've done in Arkansas, and I believe the success of it. You see other states that are joining in, and so we have well over a majority of the states that are a part of that Medicaid expansion. Also, though, it's a success story because we've controlled the cost, and we've maintained our commitment to the legislature, to the public, that we're going to make this work from a cost standpoint. So we've improved access to health care. We've controlled the cost of it, and we continue to do that. The legislature has been a a watchdog on both of those aspects of it. And over time, as you can see, that while it was contentious, the first session in which, first couple of sessions actually, in order to get the 3/4 vote that was required this last time, as Representative Lademan pointed out, it went through smoothly with the highest level of support ever. And so it's part of the fabric of our healthcare systems now. I think it is an important success story, but we got to do better. And that's why this initiative, calling upon our insurance companies, not just to provide insurance and pay bills, but to actually engage in improving health outcomes and holding them accountable for it, is so critical. And so it's not just a past success story, but it is an ongoing effort that hopefully will pay dividends in this next session as well. Representative Gray, see we haven't heard, why don't you wrap up here?
Thank you so much. And, you know, I've told this story many times, but when I campaigned back in 2014, I actually campaigned against the Affordable Care Act. And so here we come 7 years later, and I was the lead House sponsor on it. The governor put me on the task force, the healthcare task force, during my first session, and I understood what this did, or the lack of the Medicaid expansion, how it would hurt the state of Arkansas, how it would hurt my constituents and constituents across the state. One of the things that I absolutely loved was Secretary Gillespie and now Secretary White met with all of us legislators multiple times. They wanted to hear, not just the ones that supported it, they wanted to hear from us that didn't support it. What are your issues with it? What can we do to make it better? How can we make it better for the state, for our constituents? And it took us, I think we met for maybe a year in total, to come up with the accountability piece for the insurance companies, to come up with the populations that needed our assistance the most, and that fine, the detail. Which is kind of how that Life 360 came to be. So I went from someone who was 100% against this philosophically to someone who ran the bill and supports it wholeheartedly, and what it can do for our state, for our constituents, and for our hospitals that are struggling across the state, especially now with COVID. I'm super excited to see the Life 360 and all the pieces come into play, watch it operationalize. I won't be in the legislature moving forward, but I look forward to watching it play out. And I think too, the governor's sentiment, this had pretty broad bipartisan support in the legislature this last time, and I believe as you see this operationalized, you'll see that again in the future. So, thank you.
Thank you, everyone, for your attention today, and we'll look forward to continued success. Thank you.
Thank you.
Now we just got to get the